Now to this story. A recent study conducted among over 5,500 middle-class high school learners has found that more than 1 in 4 matric learners is vaping. 3 out of 10 respondents said they use their electronic smoking device within an hour of waking up every day. Nearly a quarter of those who responded cannot get through a school day without vaping. Let's speak to the person who ran the study, Professor Richard van Zyl-Smit, Professor of Respiratory Medicine at the University of Cape Town, also from Groote Hospital, joins us now. Professor, I mean, it's quite startling findings. I'm just wondering what sparked your interest and desire to do this studying, and how did you choose the schools?
Thanks, Sally. Yeah, lovely to be with you and to chat through a very important issue. It was sparked because principals that I happened to know through various connections were mentioning to me that they had issues at their particular school around vaping, and so had asked me to come and talk, and I've been talking around vaping and tobacco now for a couple of years at schools. And then as the interest grew, I realized that we didn't have any idea of what vaping looked like in high schools in South Africa. And so what was presented yesterday, or Tuesday actually, on a National Department of Health series of webinars around the legislation around tobacco was some of the early data that we've gathered, mainly from high-income schools. It was just somewhere to start, so we weren't targeting the schools particularly, but I had access to those particular schools, and so we started with schools who were probably the most likely to have a high level of vaping. I must say much higher than I think any of us had expected, but it's just the start. We need to see what the rest of the country looks like, but it's been a little bit worrying to see some of these data.
And it's interesting, I mean, I would have thought that you targeted more well-off schools purely because vaping is fairly expensive compared to cigarettes, isn't it?
Yes, I mean, that's the assumption, is that the higher income schools will see more vaping, and the lower income schools who aren't necessarily able to afford it we will see less. I don't know where that is going to where we're going to cross that line, whether that's going to be high income within big cities, or whether we're going to see it differentiation between big cities, smaller towns. That we still have to see, and that is part of a much bigger project. So
you know, I've already read out some of your findings, that 1 in 4 matric kids at these schools is using a vape regularly. But what for you was the most significant of your findings?
So I think that, well, there are 3 major issues. The first was that the best data we had comes from the South African Demographic Health Survey, which was 2016, which said 2 or 2.5% of adolescents, high schoolers were vaping, and we're seeing numbers that are exceptionally higher than that. I've been concerned, again, having spent time at the schools, that this is not the same as 10 or 15 years ago, where people would smoke behind the bicycle sheds. I think there's a different pattern here, and we're seeing a fair amount of stress and anxiety as the reasons why these high schoolers continue. And then obviously the numbers are high. 30% in some matric classes is a significant number of high schoolers vaping, and the associated nicotine doses again are particularly high.
So one of the things, there's a perception that vaping is safer than using a traditional cigarette, and I think that's because it was marketed as a safer alternative to smoking. So is vaping dangerous?
So Sally, I lecture to, I speak at the schools, and the example I use is you're asking me a question of whether hitting myself on the head with a hammer is safer than hitting myself on the head with a sledgehammer, which is not the question if you're a teenager or a high school student. The question is, should I be hitting myself on the head with a hammer at all? And the comparison, particularly for the high school students, is compared to fresh air. If it's safer than tobacco, that's an argument and a discussion for adult smokers that has no place in the discussion around adolescence and adolescent health. The fact that it may or may not be safer doesn't mean it's a habit or something that one should be starting at high school. And even if we go back to the tobacco data, the levels of vaping we're seeing now in some schools is way higher than we saw before previously with tobacco. So this is a completely new habit that's taken up by 30% of high schoolers potentially in matric, which they should never have done. And I think I said the argument that the vaping industry may say it's safer than tobacco, I really feel very strongly is completely irrelevant when we're talking to those under the age of 18.
Do we actually have any knowledge of what it might do to developing lungs? Because we know that kids start smoking, whether it's tobacco or vaping, around 14. That is still very young. They're kids, they're developing. Do we know, do we have any science on what vaping, I mean, we know how terrible cigarettes are. Do we have any science yet on what it's doing to developing lungs?
So, Sally, I think there are two elements in terms of development. The one is the lungs, and yes, the chemicals in vaping devices are far less toxic than those in tobacco cigarettes. There certainly are chemicals in vaping devices that you shouldn't be inhaling, and we don't know what that's going to do to the developing lungs. What's more of concern around vaping is the exposure to nicotine and its impact on adolescent brains. Adolescents have something called synaptic plasticity. That's why young people learn so quickly, and part of that is laying down new thoughts, information in your brain, and unfortunately nicotine can interfere with that and, for a want of a better term, rewire your brain. I don't think we ever saw high schoolers smoking in classes. These high schoolers are vaping during the class, between classes, in the bathroom. So the nicotine exposure is significantly higher to the odd puff of a cigarette on the weekend or on your way home. So I think there's both developing lungs, but also of major concern is really the nicotine impact on the brain.
And my understanding is that it's nicotine that the kids are getting addicted to. Even though you can get these vapes without nicotine, it's all about the nicotine. That's what seems to be coming through. I just want to probe a little bit more about what you said around anxiety. I mean, it makes sense because the delivery system is easier to hide. You're not striking a match. You can't, you know, it does have a smell, but it's certainly easier to inhale than starting up a cigarette. You said something about the anxiety levels. Talk to me a little bit more about that, because it's suggesting that our kids are dealing with such anxiety that they are becoming really dependent on these vapes, and different to they would become dependent on a cigarette to deal with anxiety.
Yeah, so Sally, I think you're correct there, and this is part of my background and how I've come into this. So I am a pulmonologist, but I also run a smoking cessation clinic at Groote Hospital. So my particular interest, apart from obviously understanding how much vaping is happening, is to understand how we help these high schoolers quit vaping. And the questions that we ask them, the can you get through school for a whole day, how soon do you start vaping in the morning, point towards nicotine addiction, very similar to what we would find with tobacco. And those are very high numbers in any sphere. And the other question that we are interested in is, what help would you need if you want to quit, and why do you continue? And many of the answers, and again, this is preliminary and we haven't really dug too deeply in it, but it comes through very strongly when you simply do a word cloud type analysis of their answers, that stress and anxiety, coping, come through very strongly. So I think if we're going to tackle this problem, obviously we need the legislation and all of that to come in, but we probably need to engage with the high schoolers around stress and coping. I mean, it's been difficult. I don't know how much of this is COVID related, what we would have seen prior to COVID, but certainly my impression is that a lot of vaping is a outworking of trying to cope with the stresses of high school in the current climate.
You mentioned legislation. There is a bill before Parliament that the health minister's introduced, I understand, and I think it's to do with regulating tobacco, but also vaping. Do we need a stronger set of rules? What are the rules around vaping? Is the current bill sufficient? Have you had a look at it?
Yeah, so I didn't plan the study knowing that the legislation was coming before Parliament. It was done independently, and this is why, in a sense, the data's come to the fore a little bit prematurely, because these data need to get to the parliamentarians. So we haven't finally analyzed nor written up the paper, but I said we presented it so people would know more or less what's happening. There is no legislation around vaping currently. It's a complete free-for-all. You can buy vapes almost anywhere without needing IDs or anything like that. And so the legislation before Parliament effectively will regulate vaping exactly the way tobacco is regulated, much to the consternation of the various industries. But I think from an adolescent health point of view, simply banning the sale of adolescents or sale of vaping devices to adolescents will be a good start, just to limit access. I mean, they'll always get it, and the argument that it needs to be available for adults is moot when it comes to adolescents. That's the starting point, and we absolutely need regulation. I think the bill before Parliament, we've provided comment on that from various fronts. I think it's very good. We could always do more, but compared to where we are and where we need to get to, I think it's a fantastic step forward. And really needs to be pushed hard through Parliament, and hopefully the availability of these kind of data will give them parliamentarians the boost they need to push it through.
I mean, it's startling findings that basically 30% of matrics are vaping. Some kids cannot get through a school day without vaping. Vaping's happening in the classroom. I would imagine that quite a few parents want to engage with their child about this issue. What is your advice for a parent, bearing in mind that rebellion is part of being a teenager? How do you speak to your child?
So I think, Sally, it's an interesting point you raise. We are concerned about complicit parents as well. There seems to be in some quarters parents who are quite happy for their high schoolers to vape rather than smoke. So I think there's work that needs to be done there. And again, I think the vaping is an outworking of part of adolescence. And so there are better ways to cope with stress, anxiety, sport, performance, etc. And so I think it's really engaging that these activities, I think there's a lot of social part of it too. You know, you can do fancy tricks and all of that with vaping devices. But I think engaging sensibly with your adolescent around why they are vaping, like we do with adults. Why do you continue to smoke? What are the reasons behind it? And can we assist you with that? I think that's the approach we need to take rather than being draconian.
Absolutely. Thank you so much for chatting to us. A really important subject and something that we need to be mindful of. Professor Richard van Zyl-Smit is Professor of Respiratory Medicine, University of Cape Town and Groote Hospital, telling us that they are very concerned about what vaping, specifically vaping nicotine, which is what the kids go for, is doing to developing lungs, is doing to the brain, and how it's trying to mask, it seems, real anxiety, promoting nicotine addiction. Not something you want your child to do. He put it so well. Do you want to hit yourself on the head with a sledgehammer or a very heavy sledgehammer? So in other words, smoking and vaping, really not a good idea, particularly for teenagers.